So type 1 diabetes is a condition in which the pancreas does not produce any insulin. And insulin is an essential hormone which helps the body to control the levels of glucose, which is sugar, in your blood. So our bodies produce sugar and also get sugar from foods, which can be bread, potatoes, rice, pasta, milk, and different fruits. Without insulin, the glucose builds up in your blood instead of getting converted into energy. So the root cause of type 1 diabetes is still unknown, and it's not preventable. So like eating less sugary foods does not prevent you from getting type 1 diabetes. So researchers believe that type 1 diabetes happens when the immune system destroys the cells that produce insulin. And there are different factors, which can include genetics, some viruses that can also contribute to type 1 diabetes. So type 1 diabetes usually appears during childhood or adolescence, though it can appear during adulthood as well. So some symptoms of type 1 diabetes so some symptoms are increased thirst, unattended weight loss, irritability, frequent urination, extreme hunger, fatigue and weakness, and blurred vision. So, hypoglycemia is when you have low blood sugar, and there's a couple steps on how to treat this. So first, you're going to test your blood sugars, and if it's under 3.9 milliliters of glucose per liter of blood, you need to get some fast-acting sugar. So that can include glucose tablets or glucose gel, fruit juice, regular pop, not diet, or some sugary candy like Lifesavers. Then you wait 15 minutes and you retest. Retest your glucose levels. And if your glucose levels are still below 3.9, you do another 15 to 20 grams of fast-acting sugar. And then you retest 15 minutes later, and you keep repeating these steps of eating or consuming fast-acting sugar and retesting every 15 minutes until your glucose levels are above 3.9. Then it's also best to have a snack or a meal afterwards to keep your blood sugar stable. So long-term complications of type 1 diabetes if your diabetes if it's untreated or managed inappropriately, that can result in a variety of complications, which can include heart attack, stroke, kidney failure, blindness, impotence, and amputation. So it's always best to understand the risks associated with diabetes and to keep your diabetes under control. So with this information, people will understand that type 1 diabetes is not something that they have done. It's not their fault that they have type 1 diabetes. So that's something that we can teach our clients or the individuals that we support, is it's not their fault. It's something to do with, it's an autoimmune disease. Like, there's nothing that they can do to prevent it. You can't cure it. You have to treat the symptoms. And so one of the most important things that you can do to teach the individuals that we support is how to properly count their carbs and their fat and their protein and have a healthy, well-balanced diet. And that like telling them that no, you can't have like an extra cookie or a sugary snack isn't going to be effective. Just teaching them that yes, you can have those, but in moderation, And then you have to make allowances in your meal plans to include like an extra treat or snack. So